presentation on universal health care. Health care is necessary. Everyone gets sick. Everyone gets hurt. Everyone has car insurance for car accidents. So why don't people have health insurance for accidents? Universal health care should be provided because more people would be insured. It would cost less money per person in health expenses, and it would be simple to craft a health care plan based on other countries' universal health care insurance. According to Kotlikoff, an economics professor at Boston University, who is a consultant to the Swedish and Norwegian Ministry of Finance, there are 47 million Americans without any form of health insurance. That's 1 in 5 people that do not have health insurance. 47 million Americans do not have health insurance. 8 million of those 47 million Americans are children. Children get sick very easily. They have to have inoculations against diseases. So how is not having health insurance any different than not having an inoculation? Why do so many Americans not have health insurance? Well, health insurance is not being offered through jobs as much. Cost is one of the biggest deterrents. According to Kotlikoff, Blue Cross Blue Shield full coverage for a family of 4 costs $19,757 per year. For the same healthcare coverage from United Healthcare, it costs $45,166. That's more than most people make in a year. Real-time wages have decreased, and they are 3.4% lower than they were in 1970. That means people are not having a sustainable wage. How can people afford health care if the wages keep going down? In 2007, only 59% of people were offered health insurance by their employer. According to Kotlikoff, in 2007, Medicaid and Medicare expenditures were 9.4% of the GDP. That's almost 10% of America's gross domestic product. So if someone is on Medicaid and they are working more than 20 hours per week, then they will be eligible to be covered by the Affordable Care Act. They would take 5% out of their checks each week to cover the costs, and it would cost less money overall to have health insurance for them. Universal health care insurance has a bad reputation based on misconceptions. It's very easy to get confused by the evening news. Why does universal health care stir controversy? Misconceptions are based on biased information. There's not knowing what the Affordable Care Act consists of, and accepting radio hosts and TV programs' assertions without any research. There are several myths about universal health care insurance. The first and biggest is that the United States will follow in Canada's footsteps, which Canada has a single payer, that's the government. That means that there are no private health insurance supplements allowed. It has to be through the government, through the taxpayer only. Well, that one's false. America is not doing that. If the current private insurance does not match what the Affordable Care Act covers, then the patient can upgrade his or her private insurance to cover what the Affordable Care Act does. They do not have to switch to the Affordable Care Act's coverage. Those who do not want to buy government health care can buy private insurance instead. The second myth is that universal health care insurance costs more than private insurance. That's false. As I said before, for full coverage, Blue Cross Blue Shield, for a family of 4, it's $19,757 per year. According to Fong, a researcher of ethics and diseases, the public option would cost $34 to $69 billion more than uninsured costs and Medicaid costs to the government combined. That's not even taking the 5% tax on everyone's paycheck into account. The only thing that people really agree on is that the United States healthcare system needs an overhaul. There have been several suggestions, and 2 of the most well-liked suggestions for healthcare one of them is from John McCain, and he states that families should receive $5,000 in tax credits and individuals should receive $2,500 in tax credits. That's for buying private insurance. Another is to allow patients access to the federal health insurance program, which is the same program that is provided to the senators and the House of Representatives. It's also the same insurance that the President of the United States uses. Health insurance is needed no matter how healthy anyone is. As I said before, people have auto accidents, so they have auto insurance to cover the damages they incur. It should be the same with people. No one means to break a bone. No one means to get sick. It happens. It happens automatically. It is good to know that uninsured Americans won't be paying an astronomical amount for health insurance. Now, universal health care does cost money, but the benefits outweigh the cost. Workers can actually go to the doctor instead of missing work because of illness. According to Kotlikoff, there are 47 million people that are uninsured. 8 million of the 47 million are children. Now, 47 million is a very large amount of people. Workers would also not have to contend with the cost of going to the doctor without insurance. Any insurance that will take most of the cost away is worth it. This is the end of my universal health care presentation.